Hi guys, it's Nicole Jones from the Physio Crew and just coming to you from this lovely gorgeous Peace Garden in Abbottsley. So normally I've got back to back, but today at my 11 o'clock I've got a really nice little gap, so I'm just enjoying the sunshine and letting the dogs go for a little run around as well. And I wanted to talk to you about the importance of kind of getting a clear plan when you have physiotherapy. And I have the privilege of having helped treat a lot of people with very, very complex situations. So things like road traffic accidents, spinal cord injuries, brain aneurysms, stroke, like really, really life-changing events. And sometimes I get a little bit frustrated when there's a sort of a conflict in what these people have been told. And I was speaking to a patient this morning who went and was seeing a NHS physio, and they said to him, you know, it's a waste of money, nothing's going to help you, hydro's not going to help you, physio's not going to help you, massage isn't going to help you. And I had a little bit of a frustration with that, because this person has met this gentleman once. He doesn't know necessarily the full history. He doesn't see how far this patient has come in the last sort of 18 months, and well, it's 2 years since his accident, but 18 months that I've been seeing him. And I think, you know, we have to be really, really careful as physios that we don't just, because it doesn't fit in with what we believe, completely rule it out. You know, this is a guy who suffers with a lot of pain, and actually doing the little bit of hydro, having the support, having massage, improves his quality of life. It reduces the pain, and so I found it a little bit frustrating, because what I'm finding so often is I was asking another chap who is also having treatment with me, and I said, you know, how much physio did you get following your accident? And he said, oh, you know, I get a little bit in hospital, but then when I got out, that was it. You know, that was all the therapy I got. And that makes me quite angry, because if people are saying, you know, I understand that there's cuts within the NHS, I understand that there's only a certain amount of physio that can be provided, but by actually taking away hope and telling people that they're not going to change, that when it's not the truth, that's really quite unfair. And I sometimes think that perhaps those physios haven't had the privilege, like I have, of seeing people who were told that they would never walk again. You know, I've seen people who were told you'll never be able to walk without crutches, who do that. So perhaps those people within you know, who are giving that advice, perhaps their belief system, maybe the reason that they think that people won't get better is because they haven't seen people get better. And I understand that we all have different experiences in life, we have different patients. It's also very difficult because no patients are the same, so it's never just a recipe of this is what you give the patient and this is the right amount of exercise. A lot of people say, oh, how much can I do? And I'm always really honest with them, and I say, you know, I'm not promising you that we're going to get you back to how you were after a complex trauma. Like, that isn't always that realistic. But I never say to people that they won't achieve more, because I don't know that, no one knows that, and it's about finding a balance, and it's about saying, right, okay, so you're able at the moment to do a little bit in the gym, let's try and see if you can do 5 to 10 minutes of this activity, and then let's test it. Let's do that for 6 weeks, see how you get on. If you get a little bit stronger, we'll try a little bit more, as long as it's not making your pain worse, and as long as it's not hideous. You know, even if the pain stays the same but you get a better level of function, that's still an improvement. That's still changing someone's lives. If you're 2 or 3 years post-injury, and you've got a constant, let's say 5 or 6 out of 10 in your back, and we get you doing a little bit in the hydro pool, and that allows you to do more functions, so get on and off the floor, or go for a longer walk, or be able to use your arms more. Even if you still have the 6 out of 10 pain, your function is better. So in my opinion, as a physio, I've still helped you. You're still able to have a better quality of life because of that. And that's really my aim completely, is to help people have the best quality of life that they can. And I think it's really unfair if someone just puts a ceiling on you and says, actually, that's all you're going to achieve, because no one knows. They can say, I've seen 1,000 patients with this sort of thing, but no one knows exactly what you as a person know, how you're going to respond. So we as clinicians have to be very honest. We have to say, you know, that we can't do miracles. But even you know, I have patients who come in for massage, and massage is quite a controversial thing in physio, particularly when I was working in the NHS. People would say, oh, it's not having a long-term benefit, and that is sometimes the truth. Like if you have got, say you've got a complex trauma, and there's some of that pain is being generated in the brain, well, all of the pain is generated in the brain, but say there's a bit of something called central sensitization, it might be that you are causing an afferent signal, so the signal's going up to the brain, you're having an afferent effect, and you're helping that person be able to cope and continue with their lives. Some of it will be emotional support, some of it will be the brain feeling the afferent signal, some of it will be that you're increasing blood and circulation into those muscles. But I think it's really unfair if that person has got a routine where they're doing hydro, they're doing physio, or they're doing massage. I think it's pretty awful to say, right, okay, if we've helped to improve your quality of life, we'll just take it away. Now, of course, we always try to say to a person, just try without it. So we might go to doing it every 2 weeks or every 3 weeks or every 4 weeks and try and wean people off. But there's lots of people who go to the hairdressers like every couple of weeks, or there's people that go and have a pedicure or a massage, and that improves their quality of life. So people who have had complex trauma, if the thing that allows them to stay at work is having a massage once every 3 weeks, or coming to a hydro pool and doing a rehab class every week, I think that is very harsh for someone to turn around and say that that's not beneficial. If it allows them to be at work and allows them to do things that they love doing, then that's money well spent, in my opinion. I also found it frustrating because with this particular case, it was almost like someone was saying that not me, but this person shouldn't be doing it because it was a waste of money. And that really frustrates me, because as a clinician, as a physio, like, my job is to help people. I want to change people's lives for the better and to give them a better quality of life. And in my opinion, that's not by saying to people, oh, well, that's all you can have, that's all we can do, when you don't know because you haven't tried anything else. And I found it quite offensive that someone thought that when I'm out there trying to help people and do the best that I can, that people think that I'm taking advantage of people, when actually I'm trying to help people rather than give them no support and say, right, go off on your own. And a really clear example of that, I was asking one of the chaps this morning, I was like, where would you be? I mean, he's amazing, like absolutely amazing. A year ago, he was walking with 2 elbow crutches. He could barely activate his glute as he stood onto it in stance phase. He had it, honestly, the guy now is a completely different chap. And I just thought, you know, I wish I could show this person that said that, this patient, and say, well, where would he have been had he not had this year's worth of treatment? And this guy's lucky enough that he's fortunate enough that he can afford to have it privately. But I firmly believe, you know, if I was to create this company big enough and we could get NHS contracts and we could show people what the benefit, because it's such a false economy having people being discharged at that level, because the difference to that guy's life, I mean, he's very determined, really, really determined guy, but there's a lot of people who may have never got out of their wheelchair, may never have got off their crutches. And how harsh is that of a life? If that was you, how would you feel if you had a catastrophic injury and someone turned around to you and was just like, oh, that's it, no support? Because I don't think we often do that. We don't actually look at how it would feel if it was us. I mean, I do every single day. I look at people who go through these challenges and I'm inspired by them every single day. And because they're amazing and they find such great strength and recovery. But there's a lot of people that we don't see who sit at home and never get back to work, never get to enjoy a quality of life, have a lot of mindset things that haven't been worked through, perhaps have never seen a counsellor to help deal with the issues of having a catastrophic injury. And so I just wanted to do a little video on that because I feel really, really passionate about it. And at the Physio Crew, we are here to help. Like, that is that's what motivates us. That's why we do it. You know, I always say to people, if I wasn't paid, I'd still turn up. And it's completely true. Like, some of the days that I come, I haven't been paid for, and I don't mind that. Anyway, guys, hope that's helpful.